So looking at medication, some of you may be on medication already, some of you may not have tried any medication. So this is really just a snapshot. Because people ask questions about medications, we've included it. But really it is an area that needs to be discussed on an individual basis. But this just gives you a little bit of background. So first of all, just looking at the sections on here of the process that we should be doing with trying to manage fibromyalgia. So the first thing was that you were examined and the diagnosis of fibromyalgia was made, and that was by your consultant rheumatologist. The next step is about patient education and providing you with written information. So this is what we're doing today. We're providing you with that patient education, and you will, of course, have access to these resources. The next step is about physical therapy, and that's about an individualized exercise program. Now, I don't think this always should come next. I think it's about tailoring it to the individual. But if we move further on, and it's not until later on that we get to the pharmacology, before that we need to look at sleep disturbance and looking at pain management. But I think the pharmacology does go hand in hand with the sleep disturbance and also with physical therapy, because if your pain isn't under control, it may be that you actually need the medication as an adjunct to be able to do those things. But I think the important message is that medication isn't the be-all and end-all. It's not going to be a cure. It's not going to be the one thing that helps move you forward. It's going to be those non-pharmacological interventions that are important. So all of the other information that we give you today, it's those strategies that we'd like you to address first. But of course, if people need help with the medication, it's available to you, but that needs to be discussed on an individual basis. So looking at the EULAR guidance, and they are the European League Against Rheumatism, they look at the management of rheumatology conditions. So they've reviewed the pharmacology of studies that are involved with fibromyalgia. And there is limited evidence available, so we obviously can't draw firm conclusions from this, but it does give us a guide. But the big thing that does come out of it, and I think we've found this in practice as well, is that often medication is not well tolerated. And part of that seems to be that you have this underlying sensitivity with the nervous system. But if we can get you on a medication that you do tolerate and is helpful, then of course it's worth being on it, even if it is just for a short time to allow you to move forward. But they've given us some guidance on what medication should or shouldn't be used. So there is a little bit of evidence for the use of low-dose antidepressants, such as amitriptyline, and I've put the names in here because some of you may well have heard of them before. If you haven't heard of them, then you don't need to worry. And there's also anticonvulsants, which are pregabalin and gabapentin. Muscle relaxants, so you've got medications such as cyclobenzaprine. You've also got your serotonin, noradrenaline reuptake inhibitors, such as duloxetine, and also tramadol. Now, many of these medications do have side effects, and also many of these medications have alternative uses. So when we're putting down things such as using a low-dose antidepressant or an anticonvulsant, yes, they are used in depression and in epilepsy, for example, but we use them in different dosages to make them appropriate for the use in fibromyalgia. But looking at the evidence against their use, anti-inflammatories and also your SSRIs, such as citalopram and sertraline, and capsaicin cream, that's a chili extract cream. So I don't want you to get confused with not using these medications for other things. So for example, if someone has an underlying inflammatory arthritis or they have another inflammatory condition, yes, of course, an anti-inflammatory is appropriate and you should continue to take that. Capsaicin cream does have some evidence in osteoarthritis. So if you were to have osteoarthritis in your hands, for example, and had been prescribed that, you should continue to take that. So these medications do have their use in other conditions, but the evidence at the moment isn't there for their use in fibromyalgia. And the committee made a strong against their use evaluation of strong opioids and corticosteroids. So for example, medications such as codeine or cocodamol, they're the ones you probably will have heard of. And that's really on the basis of that there really isn't any evidence for their use to being of any benefit at the moment. And of course, they do come with side effects. So we don't want to be using medication that has known side effects and potentially addictive elements to it when we haven't got the evidence that it actually is going to be helpful for you. So when we look at either prescribing or even de-prescribing, because it's important that we don't just stop taking our medications either. We need to make sure that we taper you down in these medications in a controlled way. It's important to do this either with your GP, as in rheumatology, or via the pain clinic. But we can look at that on an individual basis to see what medications may have been trialled before, what medications you may currently be on, and what medications may be helpful for you as an individual.